of the US. And you would think it is a settled law that, when it comes to importation of a product which is made by a patented process, there's infringement only if it's made by a patented process. And the question here was really whether testing is considered being made by a patented process. And the district court, I believe, said, the district court said no, and the Federal Circuit agreed. The argument put out by Momenta was that this testing method was a crucial interim step to making the drug, because to decide whether or not to process a batch further, you had to test it, and it had to pass. If it did not pass, it wouldn't go further. So they tried to broaden this making a product made by a patented process in a broader, try to broaden the scope of the 271G, which is a section being used here. And the court said no. And interestingly, Judge Dyke had a dissent in the case, and he said essentially that the claimed method is an integral part of the manufacturing because of the need to rely on the testing method to produce batches. And if we were to, let the testing methods and purification methods out of the 271G provision, then it would not have a fair result. Any method for testing or purification would not be covered, and people can easily bypass infringement by doing these activities, these patented activities outside the country. But Federal Circuit said, we've always considered making as the actual process of making the molecule or whatever the product is. In this case, testing is really not making, and unfortunately, this is our precedent, and we are not going to change that. So that was the 271G issue, and then we come to the safe harbor issue. The safe harbor issue is where the court refused to confirm the district court decision, and we've seen a number of cases where the safe harbor provisions have been broadening, and a lot of activities are gradually being considered under the safe harbor provisions, and including certain activities which are done after the filing of the NDA or ANDA. But in this case, the court said no, we are not going to broaden the scope of the safe harbor provisions to this extent. So the 271E1 is the section which applies, and it says that there is no infringement in use of a patented invention solely for uses reasonably related to the development and submission of information under FDA law. I'm paraphrasing here. And so we know what the activity, the infringing activities, alleged infringing activity was the testing of the batch testing, and the method of batch testing was patented. And this was not just for filing the ANDA. This was regular commercial production. Even during regular commercial production, they had to go through this batch testing so as to make sure each batch being sold complied with the regulatory requirements. And so the argument essentially was that we have to produce records and keep these records for FDA, even if it is commercial processing, and therefore it should be covered by the safe harbor provisions. The court said no. The court said a routine record retention requirement, which is associated with quality control testing of each batch, during a commercial production is not reasonably related to the development and submission of information. So, Teva got away because Teva was not infringing under 271G, but the Amphastar case was remanded to the district court for determination in accordance with the 271E1 exception not applying. Then we come to the next case. It is a related case in the sense that it also deals with a safe harbor provision and the same 271E1. Here, interestingly, the alleged activity infringing activity involved was partly, post approval or post filing of the NDA, and partly pre, in the sense they used the data that was generated from a patient population taking the drug to file an SNDA where they showed that taking the drug with food improved the effectiveness of the drug. So so the party having the patent had a patent which said, which basically claimed a method for assessing and analyzing data on a commercially available drug to identify a new use of that drug and then commercializing that new use. You'd think that's a really broad claim, and shouldn't that be invalid under, not being a patentable subject matter? Unfortunately, we don't have an answer to that because that was not an issue that Elan brought up before the court. But looking at the claim, you would think that it probably does not have subject matter eligibility because, where is the, patentable matter here? But anyway, so Elan filed, and as I said, Elan filed an NDA for a muscle relaxant. It's in this case scleralaxin or midazolam, and they conducted additional clinical studies where the bioavailability was significantly increased when the patient took it with food, and they filed a supplemental NDA for that, and they were sued. The court said, clinical studies are protected because activity is not routine, and Elan developed the information for submission to the FDA for changing the product label. So if the activity is being done for changing the product label, maybe developing a new use, those activities are going to be covered by the safe harbor provisions. The next case is thankfully not a safe harbor provision case. It's a case on damages. This is the last in a series of litigations involved on the drug omeprazole, Prilosec, the brand name for AstraZeneca's product. And these litigations started way back in the last century, late part of the last century, and you would wonder how come these litigations are still ongoing. So these are the tail end of those litigations, and the issue here was damages. Essentially, the infringement issues had already been decided, and Apotex was held to be infringing these patents, which are held to be valid, the 505 and the 230 patent. And most people, in the pharmaceutical world would be very familiar with these patents, which were to a core and a coating with some alkaline materials in them. And the claims were really quite ambiguous, and you would think they would be invalidated, but they were not. So the patents were valid, and Apotex had launched the product at risk And the complexity here was that Apotex was a second wave launcher of the generic omeprazole. The first wave launch was by Cutco, and Cutco was non-infringing. So it's a unique situation where there was a first ANDA launcher who launched while the patents were valid and not expired, and those the innovator did nothing about that because they were non-infringing. And then Apotex launched in a second wave. They launched at risk, and so the question was about damages, how much damages are, and the parties agreed that they are not going to be lost profits, they are going to be royalties. How they came to that, that question was not an issue, but essentially the fact that there was a first generic already there led to the fact that there would not be a lost profit issue in these damages litigation. So the question was how much should be the royalty, and the district court decided that the royalty is going to be 50% of the gross margin that Apotex sales made out of omeprazole during the patent term as well as during the 6 months pediatric exclusivity. Now, how the court arrived at the 50%, there's a case called Georgia Pacific, which is on a calculation of damages based on reasonable royalties. And it has about 15 factors. We are not going to go into those, but here's what the court considered. And the first, they considered that the price of generic omeprazole had not gone down significantly after generic entry, and that was partly because Cutco was not under any threat of litigation. They were non-infringing, clearly non-infringing, and so because there was one, Cutco did not feel any pressure to lower the price of the generic molecule. Then the court said basically Apotex had if Apotex had obtained a license, it could take a significant share of the market. That's because the generic price hadn't gone down so much, so there was scope for Apotex to lower the prices and capture a significant portion of the market. Not just from the generic manufacturer, but also from the branded products. And the branded products here were actually two, because already before the generic launch, before 2002, which was the generic launch year, AstraZeneca had launched the new wave of PPI, which was Nexium, and Nexium was already eating into Prilosec sales, which again, complicated the damages issue a little bit. But the court said, the sales of Prilosec had declined not just before, but after generic launch, but also before because of Nexium, and the Prilosec price had declined significantly. But at the same time, the generic products price had not declined so much as compared to an average products generic launch and the price decline seen with those kinds of launches. So the court decided that the OTC Prilosec did not affect the prescription price of the drug, and the court found, and then and the court said, the sales of generic would help Apotex also sell their other pharmaceutical products. So it's a question of having the desired basket of products, and sometimes what happens is when you add one generic product, it helps other products, other pharmaceutical products that you are selling by building a more desirable basket of products. But the court did not agree with the district court on the on royalties being the damages, a measure of damages when it comes to the pediatric exclusivity. The court said you cannot use the section 284, which is what provides for the royalties basis for damages in patent infringement cases, to a pediatric exclusivity, because pediatric exclusivity is not, a patent exclusivity. It is a market exclusivity, or it's a regulatory exclusivity. So the court sent this issue back to the district court for determination. Other parameters that were used for the royalty determination was the fact that the licenses benefit to Apotex was, and cost to Astra would have been considerable. So Apotex was going to gain a lot, and Astra was going to lose a lot. So accordingly, the royalties were determined to be higher for that reason. Also, the profit margins for Apotex in this case was huge. They were so huge that even after taking out the royalties of 50%, Apotex was left with 36% profit margins, which was very well within the range of 31 to 48% margins that Apotex had for other generic products they were selling. Also, AstraZeneca had licensed the same product to other parties, and Entris and Teva on royalties of 50 to 70%. Okay. I'll do that. Also, the court refused to apply the entire market value rule for determining royalties, because they said, it's meant for multi-component products. The argument that Apotex put in was, omeprazole was known. These two patents were really to the formulation. They were not to the molecule itself, and the molecule had already become generic in the sense the product patent had expired, and the court said really this cannot be applied. Multi-component situation cannot be applied here. The drug, the formulation infringes, and whether it's the formulation and not the molecule is not going to help us apportion damages in this situation. Coming on to the next case, and this is Apotex versus Daiichi. The issue here was subject matter jurisdiction for a declaratory judgment. Now, this is an interesting case in the sense that Daiichi is the innovator. Their product for treating hypertension, olmesartan medamoxil. So there were two challenges, Mylan and then Apotex. Mylan was the first filer. There were two patents listed in the Orange Book, and Mylan lost on one of them. So they were found to be infringing, and they were not able to invalidate the patent. But they did have the exclusivity by virtue of being the first filer. So while Mylan is waiting in the wings, Apotex files the ANDA. They are not the first filer. But at this point, before Apotex's filing and after Mylan's loss, Daiichi did a very smart thing. They declared, they basically disclaimed the second patent, the patent based on which Mylan had the exclusivity. They disclaimed that. So now you have two, but they did not delist it, and despite requests for delisting, they did not delist it. So the Orange Book still had two patents. Apotex filed para 3 to the one which had already been lost, the patent which had been litigated and found to be not infringing. They filed a para 3 to that one, but because the other patent was still listed, although it had been disclaimed, and the reason for disclaimer really here is that the patent was not, did not cover the proper subject matter for Orange Book listing. But that's a separate issue and doesn't really affect the outcome in this case. So Daiichi first disclaimed the patent. They did not remove it from the Orange Book, and then when Apotex filed, after filing a para 4, they were not sued. Daiichi did not sue them. So essentially, they were blocking Mylan, and Mylan was blocking the generic entry by being the first filer. They had lost, so they could not launch, and Apotex could not. So Apotex had to find a way to trigger the exclusivity. And when they went to the district court and filed a declaratory judgment of non-infringement, Daiichi moved to dismiss. They said there's no case or controversy. The patent is disclaimed. And the issue was, is there a case or controversy? And the court said yes. The district court said no. And the Federal Circuit Court, the appeals court, said yes. And they went through the regular issues that are determinative of the case or controversy test. And so these are the issues that the court looks at to determine whether there is a case or controversy. The first issue is whether the parties have a concrete stake in the judgment, and the court said yes, sure. Apotex can only trigger Mylan's exclusivity if they can get a non-infringement declaration, because in this case they were not sued for infringement. Then whether the harm is traceable to Daiichi. And Daiichi said, we are not the harming party, it's Mylan, because Mylan is the one who's got the exclusivity. The court said no, Daiichi is equally or even more responsible, because they are the ones who have listed the patent, and if the patent wasn't listed, Mylan would not have the exclusivity. So surely, but for your listing, Mylan wouldn't have exclusivity, so don't blame Mylan. You are pretty much responsible here for the harm. The third issue is whether the case is not too contingent on a future event. So Daiichi said, Apotex doesn't have tentative approval, so we don't know whether they are ever going to get approval. So it's too early for court for you to decide a declaratory judgment on this issue. Because that is really not true. In a Hatch-Waxman case, you get to sue after a filing of the ANDA. So how come if you can sue after the filing of an ANDA, then there's certainly it's not too contingent. There's never a requirement that you get a tentative approval, that the generic gets a tentative approval before they can be sued in a Hatch-Waxman case. So if they can be sued in a Hatch-Waxman case, then there's certainly it is not, the event is not too far away, and we certainly have a right to consider this case at this point. Then the last issue is whether whether the DJ action can redress the harm, and certainly it can, because once the non-infringement issue is decided, if there is a declaration of non-infringement, then Apotex only has to get a tentative approval to trigger Mylan's exclusivity. Before MMA, it wasn't possible, but with MMA for feature provisions, Apotex could pretty much trigger Mylan's exclusivity and force a feature in case they were not ready to launch. So certainly the harm can be addressed. So that's Apotex v. Daiichi, and I had one more case, but maybe I'm just going to skip that.
Yeah.
Okay.